Good morning, Mike here. So I am 5 days post-op today. Let's see, is that correct? Because Sunday I had my surgery. I came out of this OR on Monday, the 22nd at noon. I had a laminoplasty, posterior laminoplasty performed from C4 to C7. My surgeon also did did 3 separate foramonotomies on the right-hand side, on the open side of the laminoplasty, between basically C4, C5, C5, C6, C6, and C7. Today is Sunday, so I guess I'm, Tuesday, Wednesday, Thursday, Friday, Saturday. I guess I'm 6 days post-operation now. I'm at home. I only spent one night in the hospital. Doing quite well. As you can see, I'm walking today outside on a beautiful Sunday day. So I feel good for the most part. My biggest challenge through all this has just been the medications for pain. The first day I was in the hospital, as soon as I got out of surgery, they tried Oxycontin for pain. I think I had one shot of Oxycontin, and that did not go well. Made my heart race. Had all kinds of issues with that. So they put me on tramadol to manage the pain, which is a little bit lesser of a medication than it's supposed to be. Not supposed to be as strong. Took that for a couple days. Once I got home, I was still taking that. And then unfortunately, I developed some breathing problems just from the standpoint of when I was sleeping. It would wake me up. I mean, I would I would catch my breath, or couldn't catch my breath, I should say, and it would wake me up. So that was an issue. So I stopped taking the tramadol. And then yesterday, I started to develop a real bad nausea. It was intense nausea. Every time I tried to sleep, I'd be up within the hour, and I'd have real intense nausea. Never really thought I was going to have to vomit or anything like that, but the nausea was just intense. And did a little research on acetaminophen, and come to find out that obviously can cause nausea if you're taking high doses of acetaminophen, because that really was the only pain reliever that I was still left on or able to even take. So as of 1 o'clock yesterday, I stopped taking that as well. So right now, since 1 o'clock on Saturday, I haven't taken any pain medication, and I'm doing just fine without it. I feel good. The nausea is gone now that I stopped taking the acetaminophen. It's really all I take. I am going to start to take some Aleve at night, some PM Aleve, just so I can sleep. But other than that, that's it. Again, the procedure went very well. I had an excellent surgeon at University of Wisconsin health hospitals here in Wisconsin, and went quite well. Going to be a long recovery, obviously. I am dealing with some pain. It's very manageable though. It just feels, the pain at the incision site is just like, it feels like a heavy feeling, like you're carrying around like a 5-pound cedar block on your back is what it feels like. It just feels like it's there all the time. Today is the day I get to actually take the dressing off the wound, so maybe I'll post a video of that as well to show you what that looks like. But doing good, feeling good, spirits are good. Just to give you a quick update too or a quick kind of review of what my symptoms were prior to the surgery. So for me, this all started back in July. Towards the end of July, I woke up one morning and just had really sharp pain in my right shoulder. That eventually started to go down into my arm over the course of the day. I thought maybe I was having a heart attack. In fact, it was so bad I actually went to the emergency room that day. heart checked out fine, but they could just see the muscles palpating in the back of my scapula on my shoulder. Went to my own doctor a few days later after the emergency room visit. Put me on a 5-day pack of prednisone, a steroid, to help, because he suspected it was a pinched nerve in my neck. Follow-up, of course, was to go get an MRI just to make sure there wasn't anything more going on than that. And then the pain was pretty intense. In fact, of all the pain, post-surgery, pre-surgery, that was the most painful episode I had. It was back in July. That lasted for about 6 weeks. It was no joke. It was down in my scapula, down my right arm and into my forearm and down into my index finger and middle finger. Eventually those two fingers became really numb. And I had that numbness in those fingers for, I would say, another 2 or 3 weeks. Eventually it all resolved and I started feeling good again. But in the meantime, obviously I had the MRI done, met with a neurosurgeon. First time I ever met this guy. He took me through it and basically told me I needed surgery on my cervical spine. I had no idea. It was just, my neck was a mess. I had no idea. Eventually ended up going to 4 different surgeons for opinions. Pretty much all agreed that of the diagnosis, I was diagnosed with congenital spinal stenosis. Just very much needed a decompression, basically from between like C4 and C7. Interesting thing was all 4 of the surgeons, had the same diagnosis, but when it came in terms of how to do this surgery and how to address it, they all had different opinions on that. So it really ultimately came down to my comfort level, what procedure to go with, and what doctor to go with. And again, like I said, I chose a physician at the University of Wisconsin, in Madison, Wisconsin. And he said I was a candidate for laminoplasty. And I like the idea of the laminoplasty because of the idea that, I'm 55 years old, so I plan on being around a long time. So I was hoping I could preserve as much movement and motion in my neck as possible. I'm a pretty active person. I'm big into weight training, like to stay in shape. So for me, to be able to do the laminoplasty and maintain the motion was huge. So that was a big part of the decision, but also it was just a comfort level with that surgeon. He just was the right guy. I could tell from pretty much right away. Just breeded confidence. He was like, hey, I can help you. We can fix this. One thing I will mention is that just prior to my surgery, my surgery date was supposed to be not until the end of December, but early November I developed some paralysis in my right shoulder, in my right deltoid, to the point where I could barely lift anything of any weight over my head anymore. So that got me really concerned, obviously. And of course they did tell me that could happen. So my surgery date, went in for an exam. They gave me the physical test, and sure enough, they could see the significant weakness in my right my right deltoid. And from that point, they decided, no, we can't wait till the end of December. We're going to move the surgery date up if we can. And I was lucky. They were able to get me in almost like a week and a half later. So here I am. I had surgery on November 22nd. It's now, the 29th or something? 28th maybe? 28th, I guess. And unfortunately, all the pain that I had prior to the surgery is gone. I don't have any of the radicular pain. I don't have anything in my arm anymore, my shoulder. It's all gone. The only thing left is the deltoid weakness. That's still there, unfortunately. They did say that, obviously that could take some time to recover. They also did say that because they came from the back, and I was very tight in that C5 area, which controls that deltoid, at some point we may have to come in from the front and do something to address maybe a foramonotomy from the front to loosen that nerve up even more, to really get that deltoid function back 100%. So we'll see what happens with that. Right now I'm just taking it day by day. I'm hoping this nerve will come back and I'll get that strength back in that deltoid. It looks like I'm going to be off work here for about 6 to 8 weeks. Or I'm sorry, I guess it is 8 weeks now. That has already been determined. So gonna just take it easy. Get my walks in every day. Try to walk 3 times a day. I'm gonna try to gut this out without pain medication. See how that goes. Just don't seem to be able to handle the pain meds. Even the Tylenol just was too much for my system. So I'm just gonna gut out with the pain and like I said, though, I'm in pretty good shape. If I had to rate the pain right now, I'd say it's like a 2, really. I mean, it's just a tightness more than anything. It's not pain. I wouldn't even call it pain. I call it a tightness in the back of my neck at the incision site. And I know some people, when they have these procedures or procedures like them with a fusion or something like that in the posterior, they complain of the traps and shoulder muscles being really sore, maybe even having a lot of muscle contractions and stuff in their shoulders and their traps. I have none of that. 0. It's just incision site pain, and it's pretty minimal, quite honestly. So I feel very fortunate, because I know a lot of people don't have, when they have these procedures, they have all kinds of issues with that. So but yeah, that's my update. Again, this was a C4-C7 posterior laminoplasty that was performed this past Monday. It's now Sunday. So I'm six days post-op. I feel great, and look forward to feeling better as the days go on here. It's just going to take some time to get to a point where I can actually function on a daily basis, and I'm going to do my daily routine, but I feel pretty good about the way it's trending right now. So that's my update. Maybe I'll get back on later at some point and give you another update how things are going, or if there's any setbacks. Thanks.